my first half of the head to toe assessment, Miss Candler's part. So first, I would wash my hands, introduce myself. My name's Mary and I'm going to be performing your head to toe assessment today. I would provide for privacy, so I'd shut the curtain and the door. Can you tell me your name and date of birth?
Kayla Mercer, 070302.
Okay, so today I'm going to be doing your head to toe assessment and I'm going to be using 4 techniques. The first is inspection, which is where I just look at you. The second is palpation, which is where I'll touch different areas and I'll let you know beforehand so that you're more comfortable. The third is auscultation, which is where I'll use my stethoscope to listen for sounds. And the fourth is percussion, which is where I'll tap my finger to listen for resonance. Do you have any questions? Okay, do you have any allergies?
No.
Okay, I've already got the patient's vital signs, height and weight, and they were all within normal range. Can you tell me your name again?
Kayla Mercer.
Can you tell me where you're at?
UACCB.
Can you tell me what time it is?
3 o'clock.
Can you tell me why you're here?
Head to toe assessment.
Okay, so the patient is alert and oriented times 4. I'm now going to assess all 12 cranial nerves. So for cranial nerve number 1, olfactory, I'm going to first ensure patency. So can you close one nostril, breathe in? Okay, the other one. Okay, the nerves are patent bilaterally. I'm now going to perform the smell test. So I'm going to have you close your eyes and cover up one nostril and describe this smell for me.
Cappuccino.
Okay. And do the same on the opposite side.
Alcohol.
Okay. So cranial nerve number 1, olfactory, is intact. For cranial nerve number 2, optic, I've already performed a vision assessment on the patient using the Snellen and eye chart. The results were 20/20 -0 bilaterally. So cranial nerve number 2, optic, is intact. For cranial nerve number 3, oculomotor, I'm first going to assess the pupillary response to light. So the patient's pupils are 4 millimeters at rest. Look at me. And they constrict to a 2 as a reflex to light. Oh, to further assess cranial nerve number 3, oculomotor, as well as cranial nerve number 4, trochlear, and cranial nerve number 6, abducens, I'm going to do the cardinal fields of gaze test. So can you just follow my pen light with your eyes? Okay, cranial nerve number 3, oculomotor, cranial nerve number 4, trochlear, and cranial nerve number 6, abducens are all intact. For cranial nerve number 5, trigeminal, I'm first going to do the face and scalp sensation test. So can you close your eyes? Now, I need you to tell me when you feel a sensation on your face or scalp.
Now. 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 Now.
Okay. Okay, and I'm now going to turn you around, please, and do the chew test. Put my fingers right here. Can you open and close your mouth? Okay. Cranial nerve number 5, trigeminal, is intact. For cranial nerve number 6, abducens, I previously assessed that when I did the cardinal fields of gaze and it was intact. For cranial nerve number 7, facial, I'm first going to ensure that there is adequate saliva production. So can you open your mouth? Okay, you lift your tongue up. There appears to be adequate salival production, so I'm now going to do the facial expressions test. Can you close your eyes really tight? Okay, you can open them. Can you smile? Can you frown? Okay. Cranial nerve number 7, facial, is intact. To assess cranial nerve number 8, vestibulocochlear, I'm going to do the whisper test. So I'm going to occlude one of your tragus and push in on it, and I'm going to whisper a word on your other ear, and I need you to tell me what it is.
Blanket. Pumpkin.
Okay. Cranial nerve number 8, vestibulocochlear, is intact. To assess cranial nerve number 9, glossopharyngeal, I've already assessed the patient's gag reflex, and it was positive and reactive. So to further test cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, I'm going to ask the patient to swallow some water. No pressure. The patient appears to have no difficulty swallowing, so cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, are both intact. To assess cranial nerve number 11, accessory, I'm going to assess the movement and strength of the trapezius muscle. So I'm going to rest my hands on your shoulders. I need you to push up, down, and up, and down. The patient's trapezius muscles are symmetrical in both movement and strength, so cranial nerve number 11, accessory, is intact. To assess cranial nerve number 12, hypoglossal, I'm going to assess the patient's tongue for movement and fasciculation. So can you open your mouth? Stick your tongue out. Can you move it around? Okay. The patient has full movement of their tongue with no fasciculations noted. So cranial nerves number 1 through 12 are all intact. Okay. Looking at the patient, they appear to be sitting erect. Their posture is appropriate for their age. Their hands are on their lap. They're sitting on the edge of the chair, and their feet are touching the floor barely. As the client walked in, I noticed their gait, balance, and stance were smooth, balanced with no involuntary movements noted. The patient appears to be neat, clean, and dressed appropriately for a head-to-toe examination. They are smiling. Their mood and affect is positive, friendly, cooperative. Looking at the patient's overall skin, it is tan, smooth. I see no vascularities or bruises. I see no edema. Look at your hands. I see no thickening of the palms or soles. I see, let me touch your skin, sorry. The patient's skin is dry and warm. I see no tattoos or scarring. I see no lesions overall. Looks good and even in color. Nice and tan. Good. Okay. Looking at the patient's hair. Is this your natural hair color?
Yes.
Okay. It is brown, like a dark brown. It is long, thick. It appears to be evenly distributed. It is smooth. I'm going to turn you around, please. I see no abnormalities in terms of distribution or hair quality. I'm now going to touch your scalp. Okay, do you feel any tenderness?
No.
Okay, I see no lesions, nits, inhabitants, masses, nodules. I also palpate no masses, nodules, thickening of the scalp. And she said there's no tenderness noted. Okay, I'm going to turn you around. Okay. Her face is normocephalic. It is proportionate to her body and it is in proper alignment. I'm going to assess your frontal and maxillary sinuses. So just tell me if they're tender.
No.
Okay, no tenderness noted in the frontal or maxillary sinuses. I'm going to go ahead and assess your lacrimal ducts. Okay, tell me if there's any tenderness. Okay, there is no tenderness, swelling, or drainage of the lacrimal ducts. So hold this. I'm going to look at your eyelash distribution. Her eyelashes are evenly distributed and in proper placement. I see no drooping, masses, inflammation, or lesions on her eyelids or on her lacrimal ducts. I see no drainage as well. Her sclera are white. There's no inflammation or drainage bilaterally. Can you pull down your conjunctiva? Conjunctiva are pink and moist bilaterally. I see no inflammation, redness, swelling, or drainage. Okay, her pupils are 4 millimeters. They are round. They are equal and dark. Her irises are flat and green and pretty, and they are the color is evenly distributed bilaterally. Okay, now I'm going to assess your direct and consensual light reflexes. So can you look at me? patient's direct light reflexes are positive bilaterally. The patient's consensual light reflexes are positive bilaterally. Can you look behind me? Okay, can you follow my pen light, please? Patient's accommodation reflex is reactive. Okay, now I'm going to look at the patient's nose. It is midline. It's in proper alignment. I see no lesions, piercings, or abnormalities on the external nose. Under her nose, I see no drainage or exudate. I see no lesions within either nair. I see no septal deviation. I see no redness or swelling. Okay, now can you tuck your hair back? I'm gonna go ahead and do your ears. Okay, her ears are symmetrical and in proper alignment. I see no malformation or any abnormalities. Looking at both auricles, I see no discoloration, redness, lesions, or abnormalities there. Okay, I'm going to touch both auricles and your tragus and just tell me if either one are tender. Okay, no tenderness noted on the tragus or auricles bilaterally. I'm just going to check for your external exudate or swelling. I see no redness, swelling, exudate, or drainage on the left external ear canal or right external ear canal. I see no redness, drainage, or swelling as well. Okay. Now I'm going to look at your mouth on my glass. Glove tutorial. Okay. So, looking at the patient's lips, they are pink, smooth, moist, with no redness, inflammation, or lesions noted. Can you open your mouth, please? Looking at the patient's gums, they are also pink and moist with no inflammation, redness, or lesions noted. Okay. Can you stick out your tongue, please? I'm gonna rub it with this. Okay. Upon palpation, I feel no nodule on the patient's tongue. Can you stick your tongue out again? I'm sorry. The patient's tongue also appears to be pink and moist with no lesions, masses, or nodules noted, no swelling. Okay, can you open your mouth again, please? The patient's teeth are white, straight, shiny, with no caries or malocclusions or fillings noted. The patient's buccal mucosa are pink and moist with no lesions, inflammation, or swelling noted. Let me go ahead and do your hard and soft palate. The patient's hard palate is white with transverse rugae. I see no redness or malformations there. Her soft palate is pink, moist, smooth. I see no lesions or redness there. Okay, I'm gonna stick this on your mouth. Okay. Okay, can you say ah for me?
Ah.
The patient's okay, that's enough. The patient's uvula is midline and it is reactive when she says ah. It is pink and smooth. Let me see again, I'm sorry. The patient's tonsils are +2. They are smooth and pink, no redness, inflammation noted. Her pharynx is pink, smooth, and moist. No redness, drainage, or inflammation noted. Okay, so now I'm going to look at the client's neck. Her neck is cute and it appears to be symmetrical. I'm gonna take my gloves off. There's also a proportionate choice for her body and correct alignment, all of that. Can you tell me if any of this is tender right here?
No.
Okay. No tenderness noted on the neck muscles. I'm now going to do your carotid pulses. Here. Okay. Patient's carotid pulses are +2 bilaterally. I'm now going to listen for bruise, So what I'm going to do is use my stethoscope to listen, and there's going to be 3 spots on each side. I need you to take a breath and hold it for each spot. Okay. I'm going to try not to let you pass out. No promises.
Okay.
I'm just playing. I'm going to use the bell. Okay, can you take a deep breath in? Hold it. Exhale. Take a deep breath in. Hold it. Exhale. Take a deep breath in. Hold it. Exhale. You are doing beautifully. Take a deep breath in. Hold it. Exhale. Take a deep breath in. Hold it. Exhale. Deep breath in. Hold it. Exhale. Awesome. No worries noted bilaterally. Okay. Good job, Kayla.
Thank you.
I am now going to assess the client's range of motion of their neck. So can you look down? Can you look all the way back? Can you look to one side? Opposite side? Can you go all around? Client's range of motion is fully intact with no limitations. I'm now going to name the lymph nodes. This is my time to shine, Kayla. Pre-auricular, posterior auricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, can you Hulk mode? Posterior cervical, supraclavicular. Good job, Kayla. And that concludes my first half.